Okay, welcome back to the Oral Health Podcast. Now, rounding off January, it is a time where we need to sit and reflect on some more serious health risks that we can unfortunately face at some point in our life, many of us, and that is the risk of strokes. Now, stroke prevention and oral health go hand in hand in ways you might not necessarily expect. So we're going to sit and talk to you today about how lowering your risk of gum disease actually also in turn will lower your risk of developing a stroke. So Karen, obviously systemic links with oral health, putting the mouth in the body and the mouth body connection is something that we've spoke about an awful lot. But specifically with strokes, it's always surprising to me how many people maybe don't necessarily understand that the link the two share is so significant.
Yeah, absolutely. And it is something about keeping the whole body healthy. And like you say, often the mouth is treated as a completely separate entity, but more and more research is showing the links between systemic health and oral health. So this is why it is so important that we keep our mouths as healthy as we can and make sure that we reduce our risk of not just stroke, but lots of other systemic diseases. Obviously, we're focusing on stroke today. So, research has shown that people with severe gum disease have a significantly higher risk of stroke. So that means if you have got problems with your gums, especially if it's not been treated, um, you are on a much higher risk of stroke. So when they've looked at the arteries of stroke patients, oral bacteria has been found in these arteries. So that shows that the bacteria from the mouth is passing through the body and it is leading to and contributing to stroke. So when we treat the gum disease, we reduce the inflammation levels in the body. So we stop this oral bacteria being passed on through. So we can reduce the risk of stroke in the same way that other health and lifestyle changes can do. So it's not just oral health on its own, although it is a big factor, but there are other things to take into consideration. But like you say, the oral health aspect is sometimes not the one that we would immediately think. We think of sort of weight and activity and
Yeah,
that kind
blood
of thing.
pressures, cholesterols,
Totally.
all the standard things
Yeah.
that all, like to be clear, they do very much play a role in stroke prevention. But this is so often missed off that list. And now that I'm more educated about it, it's something I share whenever it comes up. And I sometimes wonder, well, if more people knew about this, then how many less stroke patients would we even see, you know?
Yeah, absolutely. So it's so important to look out for the signs of gum disease. And we know that there are many people that don't have access to a dentist at the moment. So
Yes.
it is it's more difficult if you're not going to the dentist regularly because they will pick up the signs of this and they will warn you and take steps. So you need to, if you're not able to see a dentist regularly, just look out for certain signs of gum disease, which will start with gingivitis. Gingivitis is where the gums swell. They look up sort of a darker red in colour and they kind of have a rolled edge. So a healthy gum is pink and it's got like a stippled effect to it and it is flush to the tooth. Whereas a swollen gum will be pulled away slightly and the edge will be rounded. Also, you'll probably find that the gums bleed when you brush your teeth. So that is
Hmm.
the first stage. Now, gingivitis is reversible. So picking up your oral hygiene routine, making sure you're cleaning in between your teeth, using a mouthwash if you want to. There are lots of antibacterial mouthwashes around, which will help to reduce the bacteria in your mouth. Um, and if you do that within a couple of weeks, you'll probably find that your gums are less swollen, bleed less. And if you continue to do that, they will be significantly more healthy. But just ignore the bleeding to a degree. So your gums are bleeding because they're irritated because there's plaque on them. They're not bleeding because they're damaged per se. There's not an injury to them. So the bleeding is your sign that you need to brush more.
Yes.
Um,
And I think maybe
However,
some people think that it's the opposite, right? If it's bleeding, they
totally,
need to leave it alone. No,
yeah,
not the
no,
case.
no. It means that those gums are irritated. So if you find that they are still bleeding, you can't get on top of it, then you really need to seek professional help. If gingivitis proceeds, it turns into periodontitis. Now, periodontitis is the second stage of gum disease where it's not reversible. So what is happening is you are losing the bone, the gum is sort of shrinking away. It's almost getting away from the irritant, but it's taking the bone with it as well. Now, eventually, the bone that supports the tooth will will shrink so much that the teeth become loose. So that then we would count as being severe gum disease if it's affected the bone that much. So then you really do need to be getting some treatment and some getting onto a maintenance program to reduce these risks that you may have. So yeah, it's about then finding a dentist or a hygienist, because don't forget, you can see a hygienist without seeing a dentist these days. So that is always an option. If you can't find a dentist, you could see a hygienist. And they will be able to clean your gums and your teeth and give you all the preventative advice that you need. So they're a very important part of the dental team that, as I say, you can see if you can't see a
Absolutely,
dentist.
yeah. And that's it. That service is called Direct Access, isn't
That's
it?
correct.
Yeah.
Yeah,
We'll link
yeah.
a bit more information about that in the description of the podcast. And actually, maybe, Karen, that's deserving of a topic all on its own, talking about how to make use of that. And
Yeah, indeed.
yeah,
I mean, it's not an NHS service, I will point out, it is an
yeah,
NHS service, but it will be cheaper than perhaps going for treatment at the dentist. It's kind of a stopgap in between. So
yes.
whilst you probably need a full checkup and you might need fillings, etc., you can still see the hygienist to sort of look at your gums and try and get them healthy. And if they see something, they will probably say, right, you do need to see a dentist.
Hmm.
It's something out of their scope of practice. So um, it's not it's not an instead of, it's a stopgap until you can find an NHS dentist if an NHS dentist is what you're looking for.
Yeah, definitely. And prevention's always better than cure. We hammer on about that so much because it's never going to stop being true, is it? Let's be
Yeah.
honest.
But
It's the
it
best
works for a
advice
lot
we've
of
got.
things.
It does. And especially with both of the things we're discussing today, like taking steps to look after your mouth will in turn lower your risk of developing things like a stroke. If you are at low risk for gum disease, it lowers your risk, okay? So it's important we discuss this, and I hope that you've learned something from listening to us talk about this, and I hope that you share this knowledge with others to help them keep their risk of stroke low and their risk of gum disease low. Now, come back next time when we're going to be talking about something different, and let's just hope something a little bit more cheerful than strokes.